So you've got to get a dentist. If you have a dentist remove a tooth, or if there's a problem with a tooth, or if there's a root canal in there, which is literally dead material, your body is going to respond systemically. Now, the way a tooth is supposed to be removed is, like in America, when they pull a tooth, they'll pull a tooth and give you an antibiotic and pain reliever. That can leave the ligament in place and create a subclinical infection called a cavitation. This means your immune system is always going to be active. So the way a tooth is supposed to be removed is a tooth comes out, then you got to go back in. Totally different operation to remove the ligament. Then you've got to take the patient's blood, spin it down to plasma cell, inject the opening so the bone regenerates. You treat that with ozone, and that whole process is done with a vitamin C IV. So that way, that's the best in the world. That's what we do in our clinic in Tijuana. But if you haven't had that, or if you have a root canal, you've got to find out if it's negatively affecting you. A full torso thermography, lateral neck, A to P will also tell you, because lymph drainage for the whole face and mouth drain to the right chest area. So if we see a hot spot here and a hot spot here, that cavitation could be affecting you. You might not even feel it. So you've got to get a dentist. Huggins protocol is the best of a dentist that can do a panoramic x-ray, but they're going to look at that x-ray completely different than the standard dentist. So make sure that you get checked by a Huggins protocol dentist. Identify cavitations and identify if root canals can be a problem, because even though it's a subclinical, so you don't feel it, but it could be affecting your entire body. So please look for cavitations. Cavitations are the most overlooked chronic illness, chronic irritant. And I'm talking with fibromyalgia, with multiple sclerosis, with neurologic diseases. Okay, this is one of the most commonly missed parts, contributing factors.